Okay, thank you all for joining this month's Clinical Supervision Webinar. My name is Tamara Paris. I'm from the Central East ATTC. I'm going to hand it over to Ryan Springer, who is our project director, and he's going to provide you all with a brief introduction before I come back and address some housekeeping issues.
Okay, good morning everybody. Good afternoon actually. Thanks for joining the webinar, as Tamara mentioned. Ryan Spring, Executive Director of the Dania Institute and also Project Director for Central East ATTC. And so we're going to go ahead and I'm going to give you a little update on some information we have on future trainings coming up beyond this webinar series. And our presenter, Dr. Steve Gallen, who will give you details on the six series itself, the six webinars itself. So first of all, we are Central East ATTC. We are one of 14 regional centers across the nation, and we also have a national office in Kansas City, Missouri. And so I'm first going to tell you about a training we have coming up on clinical supervision foundations. And this is going to be held, it's actually the target audience, anyone professionals interested in basic fundamentals of supervision. And there are going to be three components. There's an online component for this, it's 14 hours, and then a face-to-face workshop, another 14 hours. And after the face-to-face, there's a work site assignment of 2 hours, so 30 hours total. And this is a basic fundamentals in clinical supervision. So after you finish up with the workshop, these webinars, if you're interested in that course, that'll be coming up shortly. Next slide. And as I mentioned, Central East is going to be having one of these trainings coming up shortly, but also some of the other regional centers will be hosting these basic trainings as well. So if you go to the ATTC website, the national ATTC website, you can find out which ATTC in your region is going to be having a basic training. This is a list of several, and I'm sure there are more that are doing having these trainings since I put this slide together. So our fundamentals course, the basic fundamentals course in the Central East region will be held on May 24th and 25th. That'll be the face-to-face. It's going to be in Columbia, Maryland, a maximum of 25 individuals, and we're expecting registration to begin sometime in mid-April. So more information will be coming out and on our website about that. And then after the basic training, we're actually going to be hosting as well a national training of trainers, and that face-to-face is happening in July. You can see the dates for registration, etc. And that will also be in Baltimore, Maryland at the airport. And the idea here is that individuals who complete the basic training and are interested in becoming trainers in this topic, they would then, once they meet the criteria, they can move on to the training of trainer program. And at this point, I'll let Tamara go ahead and get into the details of logistics for today.
Okay, just to give you guys some housekeeping items, here you should have a control panel at your right-hand corner. Just to show you how that works, I know that blocks the PowerPoint presentation. If you click on the orange button, that will allow you to minimize the screen. And then to maximize the screen again, sorry, my computer is getting stuck. To maximize the screen, you'll have to press the orange button once again. For this webinar, for these series, all lines are muted. We will allow for a question and answer period. To submit your questions, you will use the chat function of GoToWebinar, and we will respond to key questions. The questions that we don't get to, what we'll do is we'll summarize the questions and provide answers at a later time. Just so that you all are aware, we are offering 1.5 contact hours for NADAC and NBCC. Participants will receive within 10 business days an email with that certificate. I do know that we have some groups that are joining on the webinar. We have asked for everyone to register, but if you could please make sure to complete a sign-in sheet so that we can make sure that we send out a sign-in sheet with the email addresses that you use to register so that we can send out certificates to all the attendees. And if you have any questions, you can email me. And that's it.
And at this point, I'll give you a brief introduction to our presenter today, Dr. Steve Gallen. His full bio is on our website. You can read the full bio there, and any details and updates around the course, we'll provide them on the website. But Dr. Gallen is a former director of the Northwest Frontier ATTC, so he's a friend of ours for a long time. He's currently active in development of materials, training programs, and technical assistance services that promote the enhancement of clinical services in community behavioral health settings. And we've worked with Steve for many years around clinical supervision. He's been involved in our basic training or training of trainer events. He's actually going to be doing our hosting or training of trainer event coming up in July. So if you are interested, you'll be seeing Steve again. But he's been around for a while, the greatest professional, and we're thankful and grateful to have him on the training today. So with
Sounds like I might be on. Thank you, Ryan.
Sure.
This is the first in a series of 6 webinars that we're going to be conducting. And I want to show you first the schedule for the topics for the upcoming events. We're going to be covering the supervisory interview today. And then in May, our topic will be vicarious liability, the kind of accountability issues that tend to surface when we become supervisors, kind of the legal aspects of becoming a supervisor and the degree to which we're held accountable for the actions of our supervisees. We'll be talking about that in May. In June, we'll be talking about boundary issues. Supervisors have significant power over their supervisees, which creates some changes in relationships, and we're going to be talking about how relationships change and how we might manage those relationship changes. In July, we're going to talk about keys to performance success. Going to review 8 different steps to assure that supervisees have a maximum potential for being successful in their work. In August, we're going to take a look at the utility of data, how gathering information about the work of our supervisees and providing them with data-based feedback can actually enhance the supervisory relationship. And then the last session in the series, the last webinar, is going to focus on a collaborative project that's still kind of in the works, in the making. But there will be a combination of the Addiction Technology Transfer Centers and NIATEX, the Network for the Improvement of Addiction Treatment. And more about that will be discussed in the September webinar. So let's get into today's topic, the supervisory interview. We're going to be sharing a model for doing interviews that you can apply in both brief encounters and in more traditional interviews with supervisees. We're going to break it down into 2 different kinds. We're going to talk about the basic structure of the supervisory interview. We're going to talk about the sources of performance problems and how supervision can be differential with regard to adopting strategies that are geared toward effective intervention with specific performance problems that employees might be having. We're going to take a look at the corrective interview also. And I think a couple of interesting features of the webinar for the next hour or hour and a half will be that we're going to do a couple of demonstrations and give you a chance to listen in on 2 different supervisory interviews and give you a chance to ask some questions about that and share your observations. We're also going to have a couple of quizzes during the next hour and a half, so and you'll be able to get instant feedback regarding those quizzes. So that's where we're headed. So let's get started. Let's first talk about the supervisory interview, what it is, and what are some of the processes that are involved. Here you have 3 goals that form the essence of what we do in supervision, at least from my perspective. Our role is to facilitate counselor development, ultimately improve job performance, and increase the effectiveness of our services with clients. When you think about counselor development, our task, in addition to helping people increase their knowledge and skills, it's also to help build confidence and a sense of self-efficacy in the performers, in your supervisees. And in order to do that, we have to see this supervisory process as a context that is supportive, and the relationship between the supervisor and the counselor or the supervisee is one of an alliance. So facilitating counselor development requires us to create an atmosphere conducive to continuous learning. And that will be some of what we talk about in the rest of this particular webinar. When we think about job performance, I think about clinical work as well as administrative work. So my job as a supervisor is to assure that the supervisee is behaving in a way that's consistent with agency policy and procedure, but is also doing work that's compliant with the clinical protocols we select, and the goal there is to enhance counselor buy-in or supervisory buy-in, and assure that they are committed to the kind of quality work that we want to have in our agency. So we're really talking about setting the bar and establishing a high bar for performance and a high bar for expectation, but doing it in the context of a supportive relationship. When we think about service effectiveness, I think about efficiency as well as outcomes. So we're really talking about, I think, how do I intervene with a counselor so that they're better able to engage clients, so that the people that they're serving are dropping out less frequently, staying in treatment longer, and participating in recovery-oriented activities. So increasing client service effectiveness is also a complicated and broad issue. When you think about what the purpose of the interview, when we talk about the interview, we're really talking about a relationship in which we establish a structure that allows for these four items, these four characteristics: feedback, teaching, learning, and evaluation. And again, all of this happens in a context that's trusting and supportive, so that when we talk about two-way feedback, I'm serious about that, and what we want to do is establish a genuineness and a sense of honesty and clarity between the supervisor and the supervisee. So let's take a look at some characteristics of this interview process. I'm going to show you one by one some characteristics. I'm going to ask you to read down the list as we go. And notice as these characteristics get revealed that there is a certain amount of tension that exists in any kind of supervisory relationship. And that really emanates from the authority that the supervisor has. When you have control or power over a person's life, when the decisions you make as a supervisor affect somebody's career, that tends to precipitate some tension. And so there's always this sense of a potential anxiety that exists between the supervisor and the supervisee. Think about an example. For example, if you walk up to the coffee machine or the water machine, or you enter the lunchroom, and supervisees that you have are engaged in conversation, what happens to that conversation when you enter their space? Usually the conversation shifts in some way. And if you ask somebody to come to your office, often the first thing that comes to the counselor's mind or the supervisee's mind is, oh, what's this about? Or uh-oh, or what did I do now? There's a sense of uncertainty that exists. So one of the things we want to do in establishing this supportive alliance is to help people relax and understand that they're going to get clear messages from you as the supervisor. Let's take a look for a minute at this interview structure, and then we're going to do a demonstration. So we've talked about the purpose of supervision as really focusing on job performance. We've talked about the importance of a supportive alliance and a relationship that is a two-way relationship. And by definition, we've also established that there is some inherent emotional charge between a supervisor and a supervisee. So how do we approach doing interviews that can be maximally productive for the supervisee so that they're not anxious about their position with the supervisor, but are actually engaged in a learning process to improve their performance? One way to do that is to use a structure. I like to talk about the interview structure as a friend. You know, structure is my friend. When I use this structure in interacting with supervisees, it tends to lessen anxiety and it tends to enhance the productivity of our meetings. Another characteristic of interviews is, and an assumption I make, is that there's a purpose for the interview. So in using a structure, I have in mind what I'm trying to accomplish in the interview. So I have to give some, as a supervisor, some forethought to what I'm trying to accomplish when I meet with a supervisee. It's a structured process with a particular purpose and a particular goal in mind. And if there isn't a goal in mind for the interview, then it becomes a situation where I'm casting about. Where, as Scott Peck once said, if I'm going on a vacation and I don't know where I'm going, any road will take me there. If I don't know where I'm going in a supervisory interview, anything can happen. But if I have an intent and a purpose for the interview, then structure will help me accomplish that purpose. So let's take a look at the various steps. The first step in interview, and these interviews, by the way, can be as brief as 5 minutes or as long as an hour, and the same structure can apply. And we're going to demonstrate in a few minutes a basic 10-minute interview, when you'll be able to see how this gets played out in an actual supervisory session. So first step, let's take a look at the first step. Setting the agenda. This is usually a very brief period of time where at the very beginning I'll tell the supervisee what we're going to talk about, what the purpose of the interview is, how much time we have, and if there are multiple issues, if we have enough time to cover multiple issues, we'll prioritize those issues. So I'll be inquiring with the supervisee, if I have time, what is it that the supervisee wants to cover during the time we have. If that's in conflict at all with my intent for the interview, then we'll have to negotiate that a bit. But usually it takes very little time, and once supervisees become aware that you do this at the beginning of every supervisory session, they'll be prepared. They will have their agenda. They'll understand that you're going to do some kind of procedure setting at the beginning, and will bring with them things that they want to talk about or the issues that they want to address. The whole purpose of that initial part of setting the stage and setting the agenda is to lessen anxiety. So if I'm coming together with an employee and to give them feedback about their job performance, I may need to let them know that I've got some positive things I want to share with them, or I may need to let them know that I've got some concerns, but their job is not in jeopardy. But there are some things that we may want to clarify and work at perhaps changing or modifying. So I do all of that right at the beginning, setting the agenda. The second step, if you want to think about it in terms of steps in the interview, is giving specific behavioral feedback. If I have some observations to share, if I've listened to a tape, or I've witnessed an interview, or I sat in on a group, or I witnessed an interaction between staff members, I'll want to give feedback in as clear and as succinct a way as I can. Think about feedback as a brief, focused message that you give to a supervisee that includes a description of their behavior, the assumptions you make about the person's motivation or what you thought was going on, and a summary of the impact of that behavior or the implications of that behavior for the future. In order to give that kind of focused feedback, we have to think about it ahead of time. So I frequently, if I have an important message to share with a supervisee, I'll take some notes about that. I'll get very clear in my mind about what it is that I want to say, because I know that the supervisee is only going to be able to remember a small number of bits of information. So the more I can give them a sentence or two of feedback, the more likely they are to hear it. If I speak in paragraphs and take 5 or 10 minutes to give feedback, what they recall from that 5 or 10 minutes may not be the essence of what I want them to remember, or it may not be the kernel of the message that I want them to hear. So feedback is crafted and prepared ahead of time if it's important. After giving feedback, then I want to give the supervisee an opportunity to discuss the feedback, share with me their observations. They may have a different idea or a different opinion, or they may have an explanation that clarifies my understanding of the situation that I observed. There may also be some opportunity to negotiate, and this is an opportunity for teaching. This is when, during the interview, we may be working on clarifying a policy or procedure or a new protocol, or we may be working on practicing a new skill. Whatever the meat of the interview is, it happens at that kind of negotiating and teaching stage. And then lastly, to wrap up the interview, it's important that we clarify what's going to happen next. Clarify what's happened today, what decisions did we make, and who's going to be doing what next. And that usually includes both the supervisee making a commitment to action and the supervisor making a commitment to action. At least making a commitment to what we'll be covering in the next interview, or revisiting this topic again in the future. On the right-hand column, you can see the skills that we rely on when we use this structure. And what I'm going to do now is invite a colleague of mine, David Jefferson, to engage with me in a 10-minute supervisory interview that I hope will demonstrate some of the tools and skills in that right-hand column. You'll also have a chance to ask questions and make comments, and I encourage you, as the interview goes along, if you do have a reaction, type it into that chat box and send it in, and then Tamara will be able to share with us some of the questions, and if there are questions for me to answer, I'll be able to respond. So, David, are you on the line?
Yes, I'm here.
Very good. Let me give a little background, David, of this interview. David is a supervisee of mine. He's a 28-year-old who has been referred by his employer after he was tested following a minor accident at work, and his test resulted in a positive for marijuana. So he's been referred by his employer. He's gone through an assessment, and he's now kind of in his second interview, and he's the counselor, and the client has come in for the second interview, and I'm the supervisor. And David made a tape of the session, and he's given it to me to review. And I have some feedback for David about what I heard on the tape. So, David, do you have a few minutes? I'd like to give you some feedback on the tape you gave me.
Yeah, I do. I'm glad we're getting to do this. I'm a little bit nervous. This is one of my first tapes I've sent in, and so I'm curious what you're going to say. Okay.
Well, I have good news for you. I have some positive reactions that I'd like to share with you. In general, I thought the interview went very well. I thought, did a good job of demonstrating the spirit of motivational interviewing. You know, we've been working here at the agency to integrate MI into our clinical work. And I know it's a significant change for some of us, and I think it was for you in the beginning. And what I heard on the tape was it was clear that this young man was not convinced that he really needed to be in treatment. He was minimizing the impact of his marijuana use. And I think you kind of surprised him when you started off the interview accepting his uncertainty and asking him, first of all, to share what some of the good things are about marijuana use. What did it do for him? And I think he was kind of knocked off balance by that. At least it seemed that way. And as he began to talk, I thought the tension in his voice went away. He seemed to relax. His voice got a little bit deeper, and he was more forthcoming as he talked about some of the positive aspects of his marijuana use. And then when I heard you ask him to share what some of the not so good, are there any, and what were they, and not so good things about drug use, his attitude didn't shift. He stayed in that kind of relaxed state. So I thought he was really able to look at both some of the positive aspects and some of the negative aspects of his drug use. And it really got, I think, you were really productive when, rather than asking him a yes-no question about whether or not anyone else in his life have complained about his drug use, you instead asked him, what comments have others made about your drug use? And that open-ended question really allowed him to talk more frankly about his wife's reaction to smoking marijuana at home. So all in all, I thought you did a great job on that interview, and I wanted you to know that I appreciate the changes you've made in your approach, and look forward to us continuing to work together to improve your skills. Now, I'm very interested in your reaction to what I've just said, but in order for me to make sure that I was clear, first of all, I'd like you to summarize what you heard me say, if you'd be willing to summarize what was the message that you received just now from me.
Well, to start off with, the message was that you were going to give me some positive side feedback about my skills, which I'm surprised because I thought I was going to be in a little bit of trouble here, so that was nice to hear. And then you complimented me on my use of looking at the positive side, the negative sides of the drug use. That was a new skill for me to use. I wasn't sure how to use it, and I too was surprised that it worked really well. So I heard you giving me some good feedback about that. And you also noted that I kind of let the process work itself out, and that when the client started talking about the not so good side, it actually was a very effective tool and made the session a lot more valuable. And you also said that I used a good open-ended question instead of a closed-ended question, where I was able to elicit more information from the client.
You got almost all of it right. That's exactly it. The other thing I really want you to hear that I said was that I recognize that this is a shift for you, and that I appreciate your willingness to embrace this new skill and to try it out.
Well, thank you. Yeah, I heard you say that, but I couldn't quite take all that in at the moment. It is a new skill, and it's pretty awkward in the beginning, and I'm just not always confident that it's going to work, but it did seem to work pretty good this time.
Well, yeah, I'm interested in what your reaction is to the whole idea of us kind of shifting our clinical focus and working on these motivational enhancement strategies. My impression is, the assumption I make is that you're embracing it and you're willing to learn, but I'm kind of interested in what your kind of behind the scenes, between the lines impression of this whole approach is.
Well, this is I like how the agency now is providing us this clinical supervision and giving us time to work out how we're using these practices and giving us feedback about how to improve our skills. before when we had these meetings, it was usually around what we were doing well or not doing well as far as performance. So I like the idea that we're getting some help on how to improve our skills, not just you know, the overall work performance.
Yeah, I know. Historically, we focused on things like charting and making sure the clinical records were up to date, and making sure all of the disclosure authorizations were signed, and we spent a lot of time on that stuff, and now we're spending more time on how we actually interact with clients.
Yeah, and I agree, and some of the meetings in the past were kind of tense, and so it'll take a little while to get used to these meetings being a little bit more of a coaching style and helpful in that way, and so it'll take a while to get used to that.
Sure, I understand that, and I think that's to be expected.
Okay.
You know, and thinking in terms of next steps, I'm wondering if you've thought about what skills do you need to, you know, within this whole motivational enhancement framework, what do you still need to work on, or what still seems to be a bit of a mystery or difficult to figure out how to integrate into your own practice?
Well, I'm finding that the motivational interviewing is a really good skill to use with the clients, but at times I still you know, I get into some situation with the clients where I really need them to do some things, and they're I don't know how to always kind of work that in a motivational interviewing kind of way, and I kind of resort to my old way of doing that, and sometimes that seems to work and sometimes it doesn't, and so I'd like to kind of find a way to use more motivational interviewing more often and get out of some of these power struggles I find myself in.
Okay. Well, would you be willing to, I don't want you to be making a tape of every interview you do, but periodically, if, for example, maybe once every 2 weeks or so, would you be willing to tape an interview and get the client's authorization and permission to tape the interview for training purposes, and then I'll review the interview and give you some more feedback, and if there are specific skills that you want to practice, we can either practice them during our individual supervision sessions, or when we come together for our once every other week staff supervision session, we could actually do some practice in the group. So wondering if you'd be willing to continue making tapes, and then we'll engage in some practice as we uncover some issues that need more work.
Yeah, that'd be great. I'd make a tape, and I'd like to make one of the tapes where I'm doing some of the things that I think are not very helpful, but I'm not sure I'm ready to share that one in the group yet.
Okay. Well, we can start with just me reviewing the tapes, and if we were going to share any tape that you make with the group, I would get your permission about that ahead of time.
Okay, that sounds good.
Great. Okay, so sometime in the next 2 weeks, I'll look forward to getting another tape from you, and in the meantime, I encourage you to continue to look over the materials we've handed out and continue to practice, and certainly come to me if you have any questions, or if you kind of hit a roadblock or a stumbling block, come and let's talk about it.
Okay, great. Thanks, Steve.
Okay. So there you see a supervisory interview, about 10 minutes long. I hope one of the things you'll notice is that you can get a lot accomplished in a short amount of time if you think about it ahead of time and you have a purpose for getting together with the supervisee. I'm interested in your reactions, so if you have any reactions, I encourage you to type them in, and Tamara will share those back with us, and I'll respond if a response is necessary. So if there are some reactions, type them in, and Tamara will let us know.
We actually have two, Steve. Do you want me to read them now?
Sure.
Okay, the first one is a question. Are there variations of this interview structure for group supervision?
I would say yes. Again, the same, similar, not exactly the same structure, but the idea of a structured time together in group is crucial, and that means that the supervisor needs to plan, or maybe have a group of a small group of supervisees that also participate in helping develop the plan. But to have a plan and a purpose and a focus when you come together for group, and if for group supervision, and if the focus is on skill development and reviewing performance, I really encourage supervisors to spend an equal amount of time on positive aspects of job performance, giving people positive feedback, playing a tape or doing a role play practice where people are successful is very important in establishing that alliance and that sense of we're a learning community. And then if there are problems that come up, making sure that it's not a critical, evaluative, judgmental response to the performance deficits or learning problems, but we make it okay to make mistakes, and we make it okay for learning. The short answer to your question is yes, you can take this structure and apply it to groups, but it requires some initial planning with by the supervisor, and in my preference is to engage with the other supervisees in planning together how we're going to spend our time.
Okay. The next question that we have is how do you work with the clinician who does not feel that there is anything that they need to improve, or those who are, again, less interested in providing feedback? How would you work with them to improve their skills?
Right. That question kind of anticipates where we're going to go in the next section of this webinar, but let me give you a brief answer, and then we'll come back to that because that's the whole focus of a corrective interview. My experience has been that if I keep the information I have to share with a supervisee as factual as possible, so if I'm giving feedback, I'm actually sharing quotes or describing behavior that I saw. In my experience, rarely will a supervisee argue with fact, but they will tend to resist judgments or generalizations or assumptions that I made that aren't supported by a report of their behavior. This is a good example of how supervisors, if you can imagine a supervisor looking down the hallway and seeing all of the clinical doors closed in the hallway, walking down the hallway, not really knowing what's going on behind those closed doors, very difficult to give performance feedback if you don't have first-hand observation, first-hand experience at seeing the counselor at work, working with clients in a clinical setting. So I think that's one thing that gets us in trouble a lot, is we'll make some assumptions about performance, but we won't have any data to share, won't have any observations to share. Now, when it comes to a person who doesn't feel like they need to make a change, we're going to deal with that in the second half of this program. So hold on to that, and we'll see if we can't get that question answered.
Steve, do you want to take one more question?
Yeah, let's do one more.
Okay. Okay. What motivational enhancement skills would you recommend when the clinician is near retirement or nearing retirement and exhibiting significantly reduced motivation towards new learning and techniques?
I think, you know, that's a difficult question, a complicated question, difficult to give a short answer to. But I would start with what excites that person. What floats their boat? What are they most interested in now, and in the clinical realm? And the more we can make supervision focused in on what the counselor has an investment in, the better. Now, if they're experiencing compassion fatigue or they're getting close to retirement and their motivation is going down, I would try to give them a positive feedback. I'd be looking for things that they do well and I'd be reinforcing those things that they do well. And I would also be planting the seed with the whole staff of our focus being on continuous improvement and helping staff members see that from the greenest of counselors to the most experienced of counselors, we never master. This is an art more than it is a science, although we're trying to adopt evidence-based practices. There's still a lot of art to the counseling role, and we never really master that. We never really learn everything we can. So I tap into that interest area that the person has. I'd also try to give them successes and try to determine what it is that is rewarding to them in the work setting. What is it that they like to do, or what is it that they feel that they're good at? Can I give them some leadership responsibilities, for example? And would they take to those? I would experiment basically with the person who's showing less than stellar motivation for continuing to learn. Best answer I can give in a short amount of time, Tamara.
Okay.
Okay, we're going to have another question and answer period a little bit later. Let's move on, and I want to provide you with an opportunity to answer some questions about the content that we've discovered so far. So you're going to see some questions appearing on the screen, and we're going to ask you to respond in a timely way, and then Tamara is going to be sharing with you the results of the questions. So in this first quiz, there are 4 questions. And Tamara, when you're ready, you can share the results. Do you have any results yet?
Steve, I'm sorry, 96% said true.
On the first question.
On the
Right.
first question.
Okay. Sounds like we don't really need to discuss that. Everybody's aware that that we're focused on job performance and quality of care. How about the second question?
Okay. We are now going to open up the poll for the second question, which is which of these is not one of the key elements of supervision, and we'll wait a little while and close that poll.
So in that question, we're just asking participants to pick one item.
Okay, and the results are in. 99% said which one is not is identification and resolution of personal issues.
Right.
And then 1% said learning new skills for engaging and retaining clients.
Actually, the answer that I had in mind was C, identification and resolution of personal issues. And the important thing there is that we're looking at job performance for sure, but if there are issues in the counselor's personal life, we as supervisors really do not want to engage in counseling people and helping them resolve those personal issues. We might want to refer them to an employee assistance program or to a therapist outside the clinic to get help with that. But if that's a boundary issue, and we'll be talking about that later in the series, but if we cross that boundary between focusing on job performance and focusing on individual personal issues, we can really get into some sticky situations. So C is the preferred answer. Learning new skills for engaging and retaining clients. I think that is one of the, if you have data about client retention and the degree to which counselors or clients are engaged in the process, meaning they're participating and seeing it valuable, we want to increase our counselor skills at enhancing engagement and the retention of clients. So I see that as definitely part of the supervisor's responsibility. Let's go to the third question, Tamara.
Okay, and this is a true or false, and we're going to give a little while for people to select one. Steve, while we're waiting for the poll to close, I have gotten a feedback, just a comment that Rebecca is thankful to be reminded about the inherited power between supervisors and supervisees.
Mm-hmm.
Okay, so the answers are in. 55% said true and 45% said false.
I anticipated there might be a little spread here. I think there, informal and relaxed could be a part of the relationship, but I was thinking more in terms of the supervisor relation is best characterized by structure and focus. So my answer was false, in the sense that an informal, relaxed relationship can also be can also lack direction and be more focused on raising issues in the moment rather than giving careful consideration to a counselor's job performance and structuring interviews so that we really focus on those performance issues. But I can see where people would answer either direction on that particular question. I think the important thing for us is to remember that using structure and having a focus and a purpose is really the key to developing an effective relationship with our supervisees. The more relaxed, the more informal, the less directed the process is, the more likely it is that supervisees may enjoy the process, but they won't get much from it, and job performance will really not be impacted very much. Let's go to the last question. Tamara, do you have the results yet?
Not yet. We are almost there, and we're here now. Okay, so majority said 36% said, 53% said securing commitment, 36% said assessing job performance, 9% said teaching and negotiating, and 2% said setting the agenda. 2% said setting the agenda.
Okay. Well, my answer was D, assessing job performance. I do think setting the agenda is an important thing to do right at the beginning of the interview to help the supervisee feel more relaxed and to understand what the process is going to be that we're going to engage in and how much time we're going to take. I think providing feedback about job performance is one of the key responsibilities we have as supervisors. Teaching and negotiating, if we're focused on enhancing job performance, becomes part and parcel of that. And then securing commitment for the next steps, that's also important. Assessing job performance, I picked that one as the element that's not part of the interview structure. It's definitely part of the supervisor's job. But in my view, the assessment of job performance is really done outside of the interview. It happens before the interview. So I'm either observing the counselor's work with a group, or I'm reviewing a tape, or I'm reading their clinical record, and I'm preparing some feedback for them. And then during the interview, I provide that feedback. So the assessment gets done not during the structured interview as much as before. Now, there's always some assessment of how the person's responding to me and how they're responding to working in the agency. That certainly happens during the interview. But in terms of their job performance, I think most of the work we do in evaluating their performance should happen outside the structured interview process. Okay, terrific. Thank you for engaging in those questions. We'll actually have another quiz coming up towards the end of the webinar. But let's move on and move into the next topic area, which is the corrective interview. We do the corrective interview, or a corrective interview, when there is a shift or a change in job performance that we're asking for. So the corrective interview establishes a contract or an agreement that hopefully will result in an improved job performance. So there's an issue that we identify, and the supervisee is going to be held accountable for making a change. In the corrective interview, we can't avoid using the authority we have as a supervisor. How we use it is crucial, but we can't. If we imagine that authority as a coat, I can't hang it up on the door and not wear it during the interview. I've got it on. I've got that authority cloak on all the time when I'm a supervisor. The corrective interview also hopefully results in a clear plan of action. The reason I say it's not a part of the disciplinary process is because we're still working on improving job performance. And I'm assuming that the relationship is positive and supportive, and that there's alliance and there's an agreement on the part of the supervisee to engage in improving their performance over the lifespan of their time of being involved in our agency. So it's not part of a punishment or a disciplinary action. There's no threat involved at the corrective interview stage. If the person doesn't respond in the corrective interview and the change that's requested by the supervisor is not made, then there might be a disciplinary action that needs to take place. But the corrective interview is not meant to be the first step of a disciplinary process. It's really just part of the supervision process. There are always going to be performance gaps. There's always going to be deficiencies. People make mistakes. They get behind in their work. They have trouble doing a part of their work that we expect them to do. So there will be a need for corrective interviews. Let's take a look a little bit further. So what are some assumptions I make, basic concepts in the corrective interview? I don't think we can avoid addressing performance problems. Too often that has happened in the past, that either the person has a prickly personality, or the supervisor just assumes that things will get better with time, and of course things in many situations don't get better with time, so they avoid addressing the problem, and what happens is it's kind of like an infection. It festers and it gets worse. So addressing performance gaps, crucial part of our job. Using the authority that we have and the power is not being bossy necessarily. Bossy meaning having an attitude, an authoritarian attitude. I'm really not talking about that. But wearing the supervisor's cloak, having that authority for holding people accountable for their actions is really part of our job. And I need to figure out a way to do it that feels comfortable to me and feels comfortable to the employee, at least as comfortable as we can make it. Here again, in the corrective interview, structure is our friend. Often, if I have to do a corrective interview and I haven't done the kind of planning that needs to be done, even if it's just a short period of planning, but taking a few notes and being aware of what I want to accomplish during the interview, I can be diverted from my course by an employee who has another agenda. They're all motivated, but they may not be motivated in the same direction I want them to be motivated. So there may be an attempt to move into tangents, to focus on an issue that I don't think is really germane or relevant. And if I don't keep in mind what that focus is for that interview, I can easily get knocked off track, and at the close of the hour or the 15 minutes or the 20 minutes, however much time we have, I didn't get my goal accomplished. So in order for me to accomplish my goal, I got to be prepared, and I have to be aware of what it is that I'm trying to accomplish. The bottom line in a corrective interview is that we ask the person to change. The slide says supervising must change to meet agency needs. Ultimately, that may be true, but at a corrective interview, it could be that we make a commitment, the employee makes a commitment, and we come back a week or 2 weeks later and discover that not significant movement or change hasn't happened. That's where my clinical skill as a supervisor comes in, because I need to tease that out and figure out, well, what's driving the failure to respond. Rather than being critical and judgmental and harsh, I need to be more understanding. We'll talk about that more in a minute. So some of the characteristics of the corrective interview are here on the screen. We're going to take a look at the structure in a minute. It's a little bit different than the, not radically different from the teaching interview, but a little bit different. As I mentioned, it's focused on specific actions or responsibilities or duties that the employee has, and that I'm going to be communicating that I'm expecting change. I'm also expecting the person can do it, and we're going to work out a method for helping the counselor make that change so that they are successful. Characteristics of the corrective interview. Now, mandatory expectations. Well, what are we talking about here? Well, we could be talking about any of these 6 bulleted items that you see on the screen. Maybe it would be helpful to share some examples. Client safety certainly has to do with if I'm working with adolescents and we're engaged in some outdoor activities, how do I assure client safety? If I'm working with a group of mandated clients, some of whom have domestic violence issues, how do I assure safety within the clinical room, within the group room, or within the counseling office? So issues related to client safety. Compliance with regulations, that can have to do that can be related to protection of confidentiality. It can be related to securing authorization for disclosure of information. It can be related to keeping the clinical record. It can be related to a required clinical protocol. Time schedules, I'm not just talking about here about coming to work on time or coming back from lunch on time, but actually being on time for clinical appointments, following the treatment schedule as it's laid out, depending on the agency that you work within. Being timely is another way to talk about that one. Non-negotiables related to principles of client care can have to do with how we greet clients, how we protect their privacy, how we engage them in treatment planning, how we give feedback to them, how we help them resolve issues in their life, the degree to which we do follow-up, if they've missed an appointment, for example. Pretty basic principles of client care. May be required, may be mandatory at the agency. And then the implementation of clinical protocols. If we're doing the matrix model of treatment, or we're using a particular screening and assessment form or protocol or process, making sure that sometimes that's non-negotiable in terms of how a clinician implements those issues. And then certainly following the ethical guidelines that we have and not violating ethical principles can fit into this mandatory expectations. So when there are mandatory expectations, we're really our goal, our process and our goal is to help our supervisees conform to those mandatory expectations. In order to do that, we have to make sure that we're very, very clear. So here's some questions or issues that need to be clarified when a request by a supervisor or by an agency is non-negotiable. You can see these principles here. The essence is I need to be able to paint a very clear picture or bring the camera into very clear focus with regard to what I'm expecting the counselor to do. I can remember, I have one example, a story I'll share with you. I was working in a clinic and we had a new person working in the administrative office, and her role at the end of the day was to make sure there were no clinical records left out. One of her jobs was to make sure that they were all locked up. And I got to work early one day before anybody else. I think I had a presentation for the county commissioners that I needed to prepare. And I came into the administration area, and on top of the file cabinet were a couple of client folders that had been left out. So I gave some feedback to this new hire who was responsible for making sure that gets done. And I just tried to reinforce how important it was, helped her see the potential implications of leaving confidential material out in the open, even though the office was locked. And she seemed to understand that, and I asked her to make sure at the end of that day to make sure those records were locked up. And she did that, and she continued to do that, or somebody did it, for the next few days. But about a week later, I came in, and there was another client record out in the to-be-filed basket. So I asked this person about it, and her response was, "Oh, I didn't know you meant me to do that every day." So I would blame myself for that situation. I don't think I was clear enough in setting the expectation for that non-negotiable expectation that the agency had for her work. And of course, she never made the mistake again. But if I'm not clear as a supervisor, then I'm likely to get non-conformance, at least performance that doesn't match my expectation or doesn't meet our standard. Very important. Now, another issue around doing corrective interviews is when we ask somebody to make a commitment to change, sometimes we have to be a little bit more investigatory with regard to what's driving the performance problem. So in this table, on the left-hand side, you can see that there are potentially I picked 5 here. There's probably more than that, but there are numerous situations that might result in performance not being what we expect. So for lack of understanding, lack of skill, fear about failure or fear about actually engaging in the process or being confused, which probably is lack of understanding, a values conflict. The person just doesn't believe in what we're doing, doesn't believe in drug testing, or doesn't believe in giving feedback about the results of a screening interview or whatever it might be, and attitude. So depending on the issue, the strategic approach that a supervisor might take shifts, a differential strategy depending on the nature of the issue. So you can see that with lack of understanding, what I really need to do as a supervisor is to make sure that the expectations are clear. And I always ask the employee to summarize what they've heard me say, so that and then to let me know what they're planning to do. And if they leave an element out, like she didn't say, when she summarized what she said she was going to do, she didn't say she's going to do it every day, I might reinforce that. So I'm listening carefully to make sure she got every piece of the instruction. And I probably would write it out in her job performance or job description and make sure she's read that as well. lack of skill, that's different. That's not necessarily clarifying expectations, but it's more engaging in a process whereby the person learns how to do the skill, and they have the skill, and I can assess the degree to which they have the skill before I actually ask them to go and use it. So that concludes teaching, training, and coaching. Sometimes a person doesn't believe they have the capacity to do it, and so what they need is a lot of support, coaching, positive feedback, and encouragement. Values conflict, I think the issue there is I have to clarify what the choices are. If a person just doesn't believe in what we're doing, then I need to clarify what the choices are. And sometimes the choices can be as harsh as working here or not working here. But I need to clarify what those are. If it's really a values conflict, then it's not a knowledge and skill issue. And then lastly, if I know the person knows how to do the work, has demonstrated their ability to do it in the past, doesn't appear to be afraid, doesn't have a values conflict with it, then the issue may be an attitude issue. And that's where this corrective interview can be very helpful. I can set limits and let them know what the bottom line is of our expectations. What is it that we're wanting to see? And then, of course, I need to document their response. And the more I can put quotes down in the documentation, the better. Okay, so let's hustle on here to take a look at how does that corrective interview then differ from the more standard teaching or standard supervisory interview. Well, here I've highlighted and read a few of the differences. When I state the expectation, as I said earlier, I ask them to play it back to me. I want to make sure that they have said in their own words what they're going to do. If a discussion is necessary, either if they're unclear in the playback or they voice some hesitancy about doing it even though they're clear on what it is that I'm asking them to do, then we might have some discussion. And my purpose in the discussion is to help them see the value, help them see the importance, help them see the implications of either doing or not doing the task at hand. And then don't hesitate to ask the question, the $64,000 question. Will you do this? The person may nod their head, they may say, uh-huh, and I may assume that they agree. But if I don't ask the question, then I might expect a more variable response in the future. But if I ask the question, will you do this, and they say yes, much more likely that they will follow through. So asking for that commitment is important. And then lastly, following through by me coming back to check or setting up another appointment to talk about this or observing their performance to make sure that they've implemented whatever it is I've asked them to do is really important. The follow through is important. If you make the request and they don't comply and they don't hear from you about it, the translation in their mind is he didn't mean what he said, or it's not important what the supervisor says, or the agency doesn't pay attention. So if it's important enough to establish a limit and to clarify what's expected, it's worth following through. So how does the interview structure look different? Here's how it looks different. Setting the agenda, basically the same. Giving feedback, basically the same, although this time you may be talking about feedback that indicates that the person is not performing the way you are hoping that they will perform in the future. The third piece is where the changes begin. Here we're presenting instructions, clarifying what the rules are, making sure that the person understands. And so it's a negotiation around a specific skill or a specific duty or a specific responsibility. And then lastly, securing commitment, asking them their willingness, clarifying the expectations, having a plan, and making sure that the person has agreed, that the supervisee has made a commitment to following through. If they don't make a commitment to following through, you might decide to meet again in a few days to talk about this, or meet again the next day, or you might have an assignment where they will read and secure additional information to help them get clear on whether they're willing to do what it is you've asked them to do, but some kind of an intermediate plan results. In order for you to walk away from the interview saying you accomplished your mission. You gave the feedback, you set the expectation, you negotiated how it will happen, and the person made a commitment to follow through. So let me show you by doing another role play with my colleague David. This time around an issue of job performance that requires a shift or a change or a modification. David, are you there?
I'm right here.
Great.
Can you hear me?
This is a situation in which David has conducted an interview. Again, he recorded it, and I was able to review it. In this interview, David was expected from the agency's perspective to use a motivational enhancement strategy. And what I noticed was something different. So I'm going to be giving David some feedback about his performance and then attempting to negotiate a change. So David, I had a chance to review the tape you made for me last week, and I wonder if now's a good time for me to give you some feedback.
This is a great time. Thank you very much.
Okay. What I'd like to do is share with you what I noticed in the tape. And I think there's some opportunity here for us to work on you improving your skills, but I'm uncertain about that, so I'm very interested in your perspective on what I observe.
Okay.
And I'll tell you what my assumptions are, and then we'll go from there. Okay?
Okay.
All right. You know, we've been working at integrating motivational methods into our work, and on this tape I noticed that the client reported to you that he had not attended a recovery meeting, a 12-step meeting yet, even though it was part of his treatment plan.
Mm-hmm.
And your response, I thought, was perhaps inconsistent with the direction we want to go, in the sense that what I heard you say was, what you need to go. This is not a negotiable in our program. You need to go to that meeting because we know that if you don't go to those meetings, you're very likely to relapse. I think that's a pretty close quote from what you said during the interview. Then when the client seemed to resist, you also mentioned that it was a requirement of the program. Mm-hmm. And I'm concerned that you might have missed an opportunity to use this motivational approach in which you would elicit from the client some of the client's hesitancy or ambivalence about going to a meeting. So I'm interested in your response to that. But first of all, before we go to how you respond to that, would you summarize what you've heard me say so far? I want to make sure I was being clear.
Well, so far that I used some feedback with my client that your impression is that that's not consistent with the policies of the organization, and I'm not following the motivational enhancement practices that we're trying to implement. Right, yeah. I thought you were being, more specifically, I thought you were being directive and a little bit threatening to the client. Yeah, I think I was being directive. I might have, I didn't want to threaten him, but I kind of wanted to bring home the message that according to the research, that people that don't go to meetings don't stand as good a chance of getting into recovery. Right, right. You know, as you think about that, I'm very interested in your response to the feedback I've given you and what you think is the right approach or the best approach to take in this situation, because I know this comes up an awful lot in our program. Well, there's two things. You know, our program and you know what I've learned since being a counselor is it's always been a policy to demand that people go to meetings. We usually aren't very negotiable about that. We kind of give people some room early on, but when people start moving through the program, we get kind of strict about it. We want them to go. This motivational interviewing doesn't, I'm not completely confident that if I use those motivational interviewing skills that I'm going to get the client to go to meetings, so I kind of fall back on what I know.
Sure, sure. Yeah, I hear you being very motivated. You want that client to go to meetings, and you're struggling to figure out the best way to make that happen.
Yeah, that's it. And I'm I'm afraid that if the client really doesn't go, that somehow we didn't do our job right, and I guess I don't have a lot of evidence yet that doing it any other way, I'm going to get the results that we want as a program.
Mm-hmm. Well, let me suggest to you that I think we need to do more study and more work on this issue, because I'm hoping that you will come to see that the use of these motivational enhancement strategies will actually make your job a bit easier and make it more likely that the client will attend meetings of their own free will, rather than feeling like they're going as a mandate from us. One of the skills that I know in my own experience anyway has worked well is giving the client an opportunity to talk about what it is they don't like about the meetings, or what assumptions they have about the meetings that keeps them from going. And there may be even some basic logistic issues like transportation or child care or something like that that's interfering also. So opening the door and allowing people to talk about what's keeping them from attending, whether it be an attitude or a belief or a concrete reality of their life, tends to make it more likely that they'll consider the options. And then we can kind of negotiate with them. If once we understand what's keeping him from the meeting, because we don't really know yet, I couldn't tell from the tape, what is it that's keeping this person from attending the meeting? Once we know that, then we might be able to provide assistance to lessen those barriers or remove the barriers totally for them going. But we can't get there if we kind of hit them with a sledgehammer right from the get-go. So I'm asking you to, would you be willing to continue studying this issue and trying some things out, and maybe even doing some role play with me, or if you're comfortable, role playing in our supervision group, so that you will feel more comfortable using these skills?
Well, I would be willing to role play these, because I'd sure like to see that this is going to work. Over the years, I've heard 1,001 excuses about why people don't go to meetings, and if there's a better way to get people to go, I'm up for learning that.
Cool. All right. Great. Well, I'd like to work with you on that. Here's what I'd like you to do before the next time we get together. I'd like you to think about, well, what is the best way for you to learn? What experiences could we plan with you that would be most helpful to you in terms of learning this new skill? We've got some demonstration tapes. We can do some role play practice. We've got the literature you can read. There's a number of vehicles, but I don't know exactly what your preferred learning style is. So what I'd like you to do is, in the interim between now and the next time we get together, think about that and bring to me next time we get together some of your own ideas about how you'd like to continue working on incorporating this skill into your practice.
Okay, I can do that.
And then we'll see if we can do it the way you want to do it.
Okay, I got some ideas. I can do that.
Great. Okay, thanks very much. We'll keep working on this.
All right, thanks, Steve.
Okay. So there's a brief example, about 10 minutes, of setting the agenda, giving feedback that's as specific and as clear as you can make it, clarifying the expectations, and then securing a commitment from the supervisee to move forward in the direction you want them to go. You'll notice that we didn't get the problem solved in one session. We only had 10 minutes, number one. And number two, usually a change in behavior is something that happens over time. It doesn't happen in the moment, in the instant. So I was pleased with David's response, and he's agreed to continue engaging and working on this issue, and He's been given the opportunity to share his skepticism about it, and hopefully didn't get criticized for that. And yet I accomplished my objective by letting him know that in the future what we expect, and we're going to be working on building his skills so he can do it. All right, now you may have some questions about that, and we'll have a brief Q&A here in a minute, but we're going to do another quiz, and I'm going to turn it over to Tamara at this point. And again, there are 4 questions, and this is a way for us to assess, for me to assess how clear I've been, and it gives you a chance to see what your colleagues, how they respond to some of these questions. So these questions are about the corrective interview, and Tamara, let's open the poll on the first true-false question.
Okay.
And Tamara, if some questions or comments have come in that I can respond to while we're waiting for the responses to get tallied up, we can kill 2 birds with 1 stone.
Okay, sure. I mean, would you have a few questions? First one, would you say that the counselor was taking a corrective interview approach with the client?
That's a good question. Was the counselor taking a corrective approach with the client? I would say no, in the sense that the counselor, David in this case, I don't know what his assumptions were. I didn't ask him about that. That kept the client from attending a meeting, but he didn't ask. He didn't inquire. And that's one of the key features of a corrective interview is in the teaching and negotiating portion of the interview, you actually ask the person for a honest response about what's preventing them from, in a supervisory sense, from using the skill or using the protocol. Because I want to understand, in order to make that kind of differential strategy, I want to understand what the barrier is. So I would say the answer was no.
Okay. All right, so we have the results from the poll. 48% said true and 52% said false.
Okay. So about half the group says that it is the first step in the disciplinary process, and half the group says it's not. My answer was false, because the disciplinary process is usually prescribed in an agency. Usually there are specific steps you have to take. In a corrective interview, I assume that I still have a positive working relationship and that there are going to be performance gaps, and every performance gap doesn't necessarily require use of the disciplinary process. That a corrective interview is often just enough to get the person started, moving in the right direction, correcting the problem, clarifying their understanding, reducing their fear, whatever was the barrier. We're able to take care of that in either one or a short series of interviews, and we don't have to get to the disciplinary process. My experience with moving to the disciplinary process is if you have to go there, it is very infrequently, I don't know what the percentage would be, but very infrequently does a positive resolution come about and the person return to good performance. Usually there's a rift. So I see the corrective interview as not part of the disciplinary process. Let's go to the second question and open the poll.
Okay, please select.
And if there's a question while people are responding, I'd be happy to take that too, or a comment.
Sure. I'm kind of searching here. During the corrective interview, the questions during the corrective interview, they've often asked about barriers during the planning and the commitment, which may have enabled efficacy of the part of the supervisee. Have you found this to be effective?
I'm not sure. Could you read that again?
Read it again?
Yeah, I'm not sure.
They often have been asked about barriers during the planning and the commitment. stage.
Yes,
Which,
talking about supervisees, asking them about barriers. Yes.
yes, so have they found that to be effective?
Sure.
On the part of the
Sometimes I
supervisor?
make the wrong assumption about a performance problem, and I make the assumption that it's a knowledge and skill issue, and it may be something else, or it may be, if I make the wrong assumption about what the source of the problem is, then I might take a strategy that's not going to be effective. So
Okay.
I think that exploration is really important, so that there's some understanding on the part of both the supervisee and the supervisor of what's driving the performance problem. Okay, are there responses to question 2?
Yes, and the results are 91% said to addresses a performance concern. 56 said utilizes the supervisor's authority. 89% said provides an opportunity for change, and 89 to addresses a specific duty or responsibility.
So it sounds like the majority basically said all of the above, all of them are true, but there was some discrepancy around the use of the supervisor's authority. My
Correct.
answer was yes, I checked all 4 of those as being applying to the corrective interview. Let me clarify the supervisor's authority. I might not have been clear about this. We have, as supervisors, we have authority to and responsibility to assure client safety, to make sure that clinical services are delivered in the most effective way we can, and to make sure that whatever rules and regulations exist get followed. So to that extent, I have to use my authority, especially during a corrective interview. There's not a balance of authority in the corrective interview. The supervisor definitely has more power. And the critical question is, how do I use that power? And do I do it in a way that supports and affirms the potential for the person who's got a performance problem to improve and to make a change? So it stays in that positive realm of you can do this, building self-efficacy. But authority is something that's definitely there, and like I said before, I can't take that off. I can't give it up. I can't put it on the bookshelf and only use it selectively. I kind of have it all the time as a supervisor. People are well aware of it all the time. Okay, question 3, another true-false question.
Okay, please select one. And we have about 2 minutes left, so.
Sounds like we'll just get the quiz finished up, and I'll make a final closing remark and we'll be done.
Okay.
Let me know what how the group responds to supervisory strategies are best based on an understanding of the factors that influence performance.
Okay, we'll give people a few more seconds, and then we'll close the polls. Okay, and the results are 94% said true.
Yep, and I agree that if we don't understand what's contributing to the problem, we can't help solve the problem. And the last question, Tamara, let's open the polls on the last question.
Okay, please select one. Okay, we'll give a few more seconds before we close this poll. Okay, and the results are Okay, 81% said clarifying consequences if a change is not forthcoming, 10% to performance-based feedback, 1% said a clear statement of expectations, and 4% to both need for follow-up and securing a commitment to change.
Yeah, that's exactly the way I saw that also. Clarifying consequences if change is not forthcoming is something that might happen in a disciplinary process, but not part of the corrective interview, because we're trying to establish and maintain this alliance between the supervisor and the supervisee. And when you threaten consequences, you disrupt that alliance. So that's the information that I have to share on the supervisory interview. I hope it's been helpful to the people. I'm going to turn it back to Tamara or Deanne at the ATTC office at this point. The next program that we have is going to be on May 4th, and we're going to focus on vicarious liability. Take care, everybody. Thank you for joining us.
Okay, and if I could just wrap up, that your feedback is important. There will be a short survey that we're asking everybody to complete. Reminder that we will have certificates within 10 business days sent to everyone, and we have recorded the webinars for viewing, and we'll send out the information on how to access that information. And that's it. Thank you all for your time.